Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And welcome back. We move into the second part of our show for this morning, where we'll be speaking with representatives from Healthcare Partners to speak about COVID-19 and some of the training that has been happening between Belize and other countries. We have joining us this morning Dr. Jorge Hidalgo, we have Nurse Minita Concha, Nurse Bradley, and Nurse Henkis. Good morning and welcome to Open Your Eyes.
Good morning. And we are I.C.U. team at BHPL.
Oh, hi. I know, we have the whole team this morning. So I know somebody, you guys wanted to say a special hello this morning?
Sure. Hi.
Hi, greetings from BHPL. Good morning.
Yes. Just want to say that, well, my name is Nurse Bradley. I'm Nurse Bradley. I'm a registered nurse here at BHPL, and I also assist here at the intensive care unit. So, yes.
Okay.
Yes, my name is Nurse Henkis. I'm a practical nurse here, and I assist as well where I can in the I.C.U. unit, as well in the COVID unit.
Okay. And then we have Nurse Minita Concha next to you guys. I know she's going to be a part of our conversation this morning. Good morning, ladies, and thank you for saying hi.
And thank you for your service.
Yeah. Now, Dr. Hidalgo, thank you for sharing part of your team with us this morning. But there's been quite a lot going on, and this is a great time for us to catch up. First of all, let's just talk about what's happening with your COVID unit. There was a time where there were no hospitalizations, but slowly we're starting to see people being admitted again for severe COVID. How are things on your end?
Well, as locally, despite of everything, we right now still with no hospitalizations at the I.C.U. COVID-19 unit.
Okay.
Of course, as we always say, we need to be prepared. I mean, we continue with training, we continue doing simulations and things because it's important for the team to be ready, because at any point we can get a critical ill patient. For right now, I'm basically happy to say that for the last couple months, we don't have no admissions at the COVID-19 units.
But you guys are open and ready in the event that it does happen.
As we saying, our COVID-19 unit is capable to handle 6 critically ill COVID-19 patients. And also we have our general I.C.U. where also we can handle the same amount of general critical ill patients.
Yeah.
Now, Dr. Hidalgo, speak to us a bit about the type of care that is provided to patients who come in with COVID. What are some of the things that they necessarily need in order to have that chance of survival?
Yeah, let's talk about when a patient needs to be admitted to a COVID-19 unit. Of course, luckily, the 80% of patients, they have no symptoms of a mild form of COVID-19. The other 10%, it can have a moderate symptoms, and probably they just need a regular care. But 5% of the patients, they will require to be admitted in a COVID-19 unit intensive care. And then the level of care and the need of oxygen is the critical part. Mean that in our COVID-19 unit, we have, since the simple, we call it nasal cannula.
Yeah.
And we essentially, as the patients require, then we increase the level of oxygen and also the different devices. We have a rebreathable mask. Also, we have something that we call it a high flow oxygen concentrator.
Yeah.
And those are the 1, 2, and 3. And if after these 3 devices, it doesn't work, then the patients will need to require to be connected to a mechanical ventilator that we have right here.
Okay. Yeah, and of course that's the last line of treatment that you would attempt.
Exactly. Most of the time, we trying to avoid a patient to be intubated and also to be connected on mechanical ventilation. At the very beginning of the pandemic, of course, because our knowledge about the condition about the COVID-19 was really poor, then as you remember, around the world, the mortality rate for a patient to be connected in a ventilator was very high.
Yes.
But as our knowledge and our understanding of the COVID-19 condition and disease has evolved, then we have more knowledge now. We still need to know more, but at least with the information we have, then we know how to proceed, the different strategies that we need to use with patients, then the mortality rate is better now.
I'm so glad you said that, because you are absolutely right. It feels like much longer ago, but it was just a year ago where people were getting hospitalized for COVID. And in fact, one of the first treatments was mechanical ventilation, which people call intubation. But it's the question I have is, 1 year later, for both you and Nurse Concha, what are some of the lessons that we learned in treating severe COVID-19 patients from the front line itself? Tell us some of the things now that have drastically changed compared to a year ago. Let's start with Nurse Concha.
Okay, some of the things that have drastically changed is that we're much more knowledgeable, and I could say for myself, even in the general wards, the same way that we treated the COVID patient. For instance, I would have a patient in respiratory distress on the ward or great pneumonia. I would use the same lessons and the same things that we did in the COVID ward. For example, I would turn them, I would put them on their side, I would put them in what we call high Fuller's position. And that, being in the COVID ward, gave us a lot of practice. I used to work I.C.U. before, but not that intense. And something that I've seen now is that we're much more versed in taking care of the patient, and we're not that frightened. And for us, for a lack of better word, it's much more easier for us right now. We finally, for example, just the whole logistics of getting patients to do X-ray, to do CT scan, to do lab works, because the CT scans and the lab personnels, they're not attached to the COVID unit. So we had to figure out all of these things, and I certainly believe that we have done well, and we have played a great part in trying to make our patients as comfortable as possible and helping with the mortality rate.
Yes. And for you, Doctor?
I'm glad you brought that up, the point of perhaps the professionals being a bit fearful at the onset of the pandemic and how that has changed. How has that matriculated into the amount of gears that is being used within the COVID-19 unit?
Yeah, it's been changing a lot. Now, at the very beginning, we essentially was completely used that we call it the PPE. The protective equipment was more strict, if we can say that. But as we've been learning about and also how the pandemic has been evolved, that is easing a lot. We in our hospital, we still require the PPE because we don't want to take any chances. But in other countries, they are using less equipment, less protective equipment, and it's essentially they are putting a lot of attention in the type of mask. Most of the time it's a double mask, the face shield, and also they use a gun, a simple gun. Okay. That is in other countries, but is
that because they're vaccinated now? That most frontline workers are vaccinated?
No, because it's for the transmission that is essentially in aerosol. No? The main thing is trying to prevent, to protect for us to inhale and for the aerosol.
Interesting. Okay. Now let's talk about just to show the level of work that you all have put in. you are now conducting trainings with other countries on mechanical ventilation. I know you recently concluded your training with medical teams in Afghanistan, and you're going to be working with medical teams in Ethiopia. Tell us a bit about that.
Yes, we work together with the American Society of Critical Care, and then one of the key parts for us is to also to be able to offer training to other countries, and of course to our own country, but also to countries that have less amount of resources. And then with that, we have the training course that is called a Fundamental Critical Care Support training course, that essentially is to teach the non-intensivists as how to manage a patient and how to stabilize a patient until someone with more expertise and more training is available, or that you also be able to transfer a patient to a more resource facility. With that, then we just completed a training for our doctors in Afghanistan, especially for Kandahar and Kabul. We did a training on via Zoom to the group of 30 physicians, and now we are preparing to train more or less 300 physicians in Ethiopia and another group in Nigeria.
This was actually something that, and maybe you can respond to whether the CMEs, the continued medical education, is still ongoing. Because this was one of the beautiful things that came out, you know, one of the silver linings that came out from the pandemic, where the specialists like yourself, Dr. Arriaga, Dr. Cuellar, you all came together and helped other medical professionals in other parts of the country to kind of learn how to manage intensive care patients.
Yeah, that's good that you mentioned that, because since April 9, 2020 to now, Doctora Larga Espada, Dr. Fernando Cuellar, and also Dr. Arriaga and myself, we are conducting 3 times a week CMEs. By now, we probably have more than 145 CMEs done over that period, meaning that we are, I can say we are only a few countries that are able to do that with the support of the to Dr. Larga Espada, to the Ministry of Health, PAHO, and other organizations that they help us to maintain that training. And then we have people, our local people, as well as we have speakers from abroad that help us 3 times a week to keep the continual medical education ongoing.
Dr. Hidalgo, as an internist, I'd like your perspective on the skepticism that there is in terms of people receiving their vaccinations. What do you say to people who are skeptical about the vaccine?
Well, you know, during the pandemic, we are fighting 2 things. We are fighting the pandemic, and we are fighting the infodemia, we call it. The infodemia, that essentially there are too much things in the social lines, too much good and bad information, and then we need to be able to try to see the sources we are reviewing, and mean that. But just to put it a simple way, all the both of us are fully vaccinated, and of course, if you say any medication have a side effect on it. There are no medication, even a simple baby aspirin, you can have an allergic reaction. Mean that if when you say that we are massive, essentially vaccinated people, and you see the amount of people with a side effect, then you say you need to weigh the balance.
Yeah.
And the balance right now, if we want to contain the pandemic, and if we aspire to any future soon, we can have get back to our normal life, then all of us need to play a role, and get vaccinated is one of those.
How can concerned are you? The perception that people have at this moment, vaccination rollout has started. There's been a loosening of restrictions, but the pandemic is not over. And we saw an outbreak in one institution a few weeks ago. We recently recorded a COVID death yesterday, and and we do have persons who are hospitalized in the I.C.U. What's the message to people about maintaining the vigilance in protecting themselves from the disease?
Yeah, as we always say, the pandemic is not over as yet. I mean that we cannot relax, and as you, Marlene, remember always since the very beginning, you as in Open Your Eyes and also us in a medical community have been very essentially strict in trying to tell the people the pandemic is not over. That means that even that we are vaccinated, we need to continue keeping our social distance measure, wearing our mask properly, washing our hands, keep the social distancing. I mean that those things we need to continue practicing because the pandemic is not over. Even that we are getting vaccinated, we need to continue. We need to trying to achieve. Some people say 50%, but others say at least 80% of vaccination to be able to aspire to herd immunity in our country.
Mm-hmm.
With the slow pace of inoculation that's happening across our country, how longer do you see us having to use face masks?
Well, again, right now the using the face mask is nothing that we can relax, at least, as I mentioned, until we, some people say more than 50%, but some others say 80%. And even so, I think so, we need to continue wearing masks. Some countries like the US, they already released that measure, but of course, this is very controversial. Yes. Because there are many other either political or economical things involved. But for the health perspective, we need to continue wearing our mask.
Yeah. As you, and we know that you keep very strong relations in the medical community worldwide. As we look at other countries, some right around us that are facing escalating cases, escalating number of cases of COVID-19, moving into what some are describing their third wave. Do you feel that if we continue on the path that we are right now, that we may end up in the same?
As we always say, the COVID-19 third wave is knocking our door. I said the last time with the second wave, and I'm saying now, we have our neighbor countries, Mexico, Guatemala, with a incredible amount of cases, also Honduras. I mean that it's just across the border. I mean that we need to be vigilant and we need to be prepared for any sort of cases that we can have at any point in time. I mean that we need to have all our measures and everything on alert, because at any point in time we can have a surge of cases.
Yeah. The BMDA put out a release over the weekend talking about the reopening of the borders and the concerns that they had there, and they cited several reasons. One of them being that we still have a very low vaccination coverage at this point. I don't remember the exact numbers, it may be over 10,000 people who have been fully vaccinated. Definitely not near the 50 or 80% that we need to have herd immunity. But they also talk about accessibility to the treatment that's being used in other parts of the world locally. Can you talk about that? Because I know you're very up to date with treatments that have been proven effective.
Well, remember that at the beginning of the pandemic, we was using many medications. We were using hydroxychloroquine. We knew now that this is not working. We used many other type of medication. Some at the very beginning also we were using a lot of antibiotics. Mm-hmm. Now we know more, and then the treatment for mild, moderate, and severe cases, we can say we know a little bit more. we still continue in a learning process. There are many medications on trial, but for now, we know if it's a mild case, it's essentially fluids and Tylenol. And also you can have your vitamins. That is nothing wrong drinking your vitamins, but it's not longer recommending any other medication based on the evidence we have now. If you have a moderate case, probably you will need to be in a hospital with oxygen, with fluids, again, and fever control, but no more than that. And then for mild to moderate cases, we can use either remdesivir, and also we can use a medication that is called monoclonal antibodies. We don't have available that in Belize. And also we can use tocilizumab, that also is not available. And we can use dexamethasone, that is being proved, that is working with patients, especially those that require to be on a ventilator. Mean that we in the country have available remdesivir and dexamethasone, but we don't have antimonoclonal antibodies, and we don't have tocilizumab.
Nurse Concha, speak to us a bit about what the greatest challenge has been in your capacity right now.
I would say the after effects is the greatest challenge, because us as nurses, keep in mind that we spend such long hours. We have to focus on ourselves as well, taking care of ourselves. So spending that long hours without probably 6 to 12 hours, 16 hours in the PPE, not being able to use the bathroom or drink water. At the end of the day, that does play a psychological effect on nurses. And I'm looking forward to having seen nurses getting the help that they need, because as I said, we as nurses, we have to look after ourselves first. Another thing, which is the greatest challenge, is that to try to keep these people alive. It's a lot of hard work. It's a lot of monitoring, and we literally, it's not that we have to, but the mere fact that we want to keep these people alive in the I.C.U. COVID unit, we sit inside the room and watch them hour by hour, or we check their vital signs every 15 minutes, depending on the status of the patient. If the status starts to change drastically, we have to check that vital signs every 5-10 minutes and do our actions, and then assess and see if it's still working. Those, I would say, has been the two most hardest part of being in the COVID unit. And I could say that going around, people are being very lax. Even when you catch the bus, for instance, we find that conductors and drivers, they're not vigilant. They would have on just this cloth mask over them. And I don't recommend that. And being that the surge is rising again, we have to resort back to the surgical mask and the N95, because those cloth masks, they're not helpful. And those will ultimately result in our demise. And worst case scenario is that our healthcare system ends up collapsing, just because of not adhering to social distance rules and being able and using not using the proper equipment, because civilians, they need to practice their due diligence, because us as nurses and doctors, we're the last line. But at the end of the day, civilians, you have to take these proper measures in helping us, because eventually we would get overworked.
Let me ask you a question. Let's talk about what is taking place at this time in preparation of the possibility of a third wave. Has there been discussions within your individual institution? And of course, I know Dr. Dalgo, you also work with the KHMH, so the public institutions, as to what we start to do if we see an escalation in cases.
Yeah, we have our unit, as I told you, we need to be prepared for any event. The fact that we have a couple months and still we have time that we don't have this amount of cases. That is also give us some time to get prepared to make sure that we have the equipment, that the equipment is working, that the most important that everybody is get the necessary train to be able to manage and to be prepared for an event surge of cases.
Okay. And, you know, we still don't talk about it enough, but COVID variants are a reality. And it's one of the things that if we pay attention to international news, we know that there are always new variants that are being detected, and some of them are more transmissible, and of recently some of them are affecting different populations. The Brazil variant, for example, affecting children. Mm-hmm. Dr. Hidalgo, this is of course a lesson for us to not let our guard down, because these variants can be here and we would know.
Yeah. Exactly, and one of the most important things, as you remember, when we spoke the last time about the variants of the COVID-19, that is going to be continued. And then we have now variants that are more transmissible. And of course, if it's more transmissible, there are more people with possibility to acquire COVID-19. And it will depend on what are the medical conditions or what are the different particulars of a patient. Then, of course, the possibility of mortality is always there. Also, as you mentioned, some of the variants are affecting younger population and children that at the very beginning we didn't see that have to happen. Yeah. And we can, in our country, we can either develop our own variants, because that's the nature of a virus. The virus is always mutating, is always changing. And if we are not able to contain and we have an outbreak of big number of cases, then that's increase the possibility of a mutation for a virus that is always mutating.
Nurse Concha, I'm glad you brought up earlier the need for us to move back to wearing the proper mask, the surgical mask, the N95 mask. Because at the beginning or at the onset of the pandemic last year, we saw that there was a very high price for masks on the market, and we've seen that change over the year. How has it been for the procurement of PPE gears within the medical field?
Well, for right now, our company has always supplied us with the necessary gears. And I could say that now, as I'm agreeing with you, that we could see now that masks are much more easily accessible. Mm-hmm. But I'm not sure if it's because people are resorting to using cloth masks, do-rags, or bandanas. That's why they're not buying the N95 or the surgical mask. But I could say that we do have a good supply of the surgical mask and the N95 mask.
Okay. Well, let's round off the conversation. I think we wanted to highlight a few things. One, definitely, I think it is a moment for us to be proud that our medical professionals are, in fact, assisting other medical teams around the world. And Dr. Hidalgo, you pointed out very clearly, we know what it's like to work with limited resources. So sharing your expertise with other countries that have the same situation is definitely one that's beneficial all around. So kudos to you and your team there for being able to conduct that. But final message to the public about being vigilant as we continue to maneuver our way through the pandemic. Let's start with you, Nurse Concha.
All right, so as I said before, everyone needs to practice their due diligence, because at the end of the day, nurses and doctors are only humans, and these PPEs, they cost, and the manpower, they cost. And I would hate to see that we're spending so much time away from our families. We're spending so much time away from our loved ones because we want to take care of patients. And it's sad to say, and I'll be frank, that we're going to end up taking care of the same people that are not vigilant. We're going to end up taking care of the people that choose to not be socially distanced and choose to not properly wear their mask or even stay home. I know it's very hard and it's difficult to be locked up in your home, but it's better that you travel alone. And I hope that with this, if we do, God forbid, that we do have a third wave, that we have medical professionals that are psychologically and physically able to carry us through that again. So my advice to my beloved Belizeans, continue wearing your surgical mask. As you reach home, you take a bath. Don't gather in large crowds. Do it for you, do it for your family, but also take consideration for the doctors and the nurses that will be involved. Might you make that mistake?
Yeah. All right. And from you, Dr. Hidalgo?
Well, as we always say, this one is a responsibility of everyone, and to be able to continue and to be able to have Belize as we are right now. All of us, the society, the medical community, you guys are playing a very important role as social media to sharing all this information and ensure that all of us adhere to the social distancing. All of us want the Belize we have right now, and even better. I mean that we need to play our role. We need to keep social distancing measures, and I believe and I hope that we continue the way we are and even better. But all of us need to do our role.
All right.
Dr. Hidalgo and Nurse Concha, thank you so much for joining us this morning and sharing a bit about what's happening at the Belize HealthCare Partners. And we wish you all the safety and blessings.
Thank you.
Thank
All
you.
right.
And with that, we're going to take our break, and we come back with our third segment where we'll be discussing with Jamie Lee Rock about the Alumni Association at the UWI.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.